So I just wanted to give you guys a little bit of information about what is going on right now, and I want to talk about the coronavirus a little bit. So, and answer a couple of the questions that you might have. So the very first one is, what exactly is the coronavirus? So the coronavirus is a respiratory illness that is spread from person to person, and it was first identified in Wuhan, China. And the symptoms have mild to severe respiratory illness with symptoms of fever, cough, and shortness of breath. According to the Center for Disease Control, it can take up to 2 to 14 days following exposure for the symptoms to develop. Now, how can you protect yourself from this? The very best way to protect yourself from the coronavirus is to make sure that you're washing your hands properly. You should be washing your hands for at least 20 seconds, making sure that you use soap and water. Hand sanitizer with 60% or greater amounts of alcohol can be effective. You should be avoiding close personal contact with anybody. You should have at least 6 feet of distance between you anytime you are around anybody that you're not normally around. At this point, you shouldn't be interacting with very many people at all because we have a stay-at-home order from the governor, which means everybody should be staying inside their house and not going hang out with your friends, not going to see family or anything like that. You should avoid crowded public spaces. One of the very few places that you should be going right now is like to the supermarket to get food. That's one of the places that's okay. You should avoid touching your face, and you should avoid contact with those who may be sick or are sick. You should not be doing any kind of traveling that isn't absolutely necessary, and you should be making sure that you're practicing good cleaning habits at home, making sure that you are washing countertops and stuff like that. In terms of a treatment, there's really no specific treatment for it. You can get medical attention to help deal with the symptoms, but unless those symptoms are severe, you really probably shouldn't even do that. You can recover, most people in fact recover from corona, and it's one of those things that takes time. How does the virus spread? We're still kind of learning about that, but we do know that it spreads in the air through coughing and sneezing. It spreads through close personal contact, and it can spread through touching surfaces where the virus is present on it. So, like if somebody coughs or sneezes on something and then you touch it, you might get it as well. The Center for Disease Controls is reporting that COVID-19, which causes the coronavirus, may survive on various surfaces for hours to days, which is why it's very important that we do all of that cleaning. People that are high risk include older adults, people who are in nursing homes, healthcare professionals, just because they're exposed to it on, at this point, probably a continuous basis. People who have immune diseases that, makes their immune system not function properly, and people that have chronic medical conditions such as diabetes, lung disease, or a heart condition. So really and truly, like right now, the best thing that you can do is to stay put, stay inside your house, just kind of chillax and not go out, and make sure that you are practicing good habits. And the idea is that we're trying to stop the spread of the disease in hopes. You might have heard something about the flattening the curve. Currently, our hospitals are overwhelmed and they can't deal with all of the patients that they have. We are doing the things that we're doing right now, like the social distancing and staying 6 feet away from people, and hopefully everybody is kind of staying at home and not going out unless it's absolutely necessary. These things are to kind of help prevent people from being infected, and it's not going to keep everybody from being infected, but the idea is that we can keep the infected population down enough so that eventually we'll get to the point where hospitals can deal with it. It's like right now, hospitals are overwhelmed. If we continue doing these things and we do them with fidelity, then we'll get to the point where there are few enough people infected that the hospitals can do what they need to help those people. So I hope that this has cleared up some of the questions that you guys might have. Again, I miss you guys, and I hope to see you soon. Bye.